You hear this term all the time, leukemia. What is leukemia? Is that a very bad cancer, or is it a not so bad, or
Right.
bad things?
Right. Well, leukemia is a form of cancer of the so-called white cells. The white cells are blood elements that are involved in a number of functions, mostly to defend us from infections. And they can become cancerous. They can become a form of cancer. Because they're blood cells, they're all over. So leukemia, contrary to some of the tumors that exist typically in adults, is present all over the body. The moment in which there are two leukemic cells, they go all over because they travel with the blood. There are two types of leukemia. One is called acute lymphoblastic leukemia. The other one is called acute myelocytic leukemia, and it's essentially identified the type of cells that is involved. The most common, fortunately, is the acute lymphoblastic leukemia. That is a disease that prior to 1948 could not be cured. In 1948, finally, some drugs came out that showed that you could actually start doing something about it. And over the work of many pioneers and many people in pediatric hematology, now we know that this disease can be cured in roughly 85% of all patients who have it in the first.
We hear girls have a better chance of
Boys traditionally have been considered a little bit more at risk, and indeed, still today, they get treated longer with this disease than girls, so that there is actually a difference in a year in the treatment.
Is there any age group where you see this, that you have a better chance of beating it?
The typical age group that is considered the best risk is between age 2 years and 10 years. You have some group of patients who are at higher risk, for instance the infants, the patients who are below 1 year of age, and generally the older you are with this disease, the more you are at risk, the more it's complicated. The issue of risk, though, it's a complex one because but for a few extreme groups, the vast majority who have kids who have this disease, we actually know that they will have a good outcome. The difference is the treatment. The treatment may be more intensive, less intensive, different drugs that allow us to actually cure this disease.
And they actually now can actually sort of like type it a little bit, get little...
Yes. For a very long time, the two most important risk group, if you want, or parameters that guide us in deciding what treatment to do for this disease was age and the white count, the number of blood cells present when the patient was diagnosed. Now, over the work of the last 20 years or so, there is a lot more information, so that both the type of cell that is specifically involved, and there is a number of them, some of the genetics of the cell itself, the response to treatment, the early response to treatment, are important factor in deciding whether or not a patient will do well with the standard treatment or will require additional treatment. It's a complex area, and it's an area that actually will become even more complex as we study more and more, and the information that comes out of the laboratories is brought to the bedside. But the important thing for people to know is the fact that all these advances really have led to a tremendous hope for patients.